Knowing you have cancer is traumatic enough. Not knowing its origin is heart-wrenching. Cancer of unknown origin or diagnostic ambiguity is one of modern medicine's most challenging mysteries. But thanks to advancements in testing, this mystery is becoming easier to solve. I'm Erica Vitrini. Join us as we examine this timely topic on a special edition of Access Health, Classifying Cancer.
You need to know what type of cancer a patient has to give them the optimal therapy. Today, by using all the technology we have available to us, we can determine the type of cancer that a patient with CUP has 90+% of the time.
My name is Dr. Cheryl Provor, and I'm an investigative analyst in the medical field with a specific focus on working with cancer patients. When someone is diagnosed with any cancer, it becomes a life or death issue. What I've found is that a diagnosis of cancer is an extremely traumatic event. Navigating cancer is as much of a psychological journey as it is a medical one, and that's true for the patient, families, and for the physicians.
It's hard enough treating a disease as ominous as cancer, but treatment without knowledge of origin is a challenge both doctor and patient never want to face. Dr. Tony Greco sheds light on the dilemma of diagnostic ambiguity.
I'm Dr. Anthony Greco. I'm a medical oncologist at the Sarah Cannon Cancer Center and Sarah Cannon Research Institute. I've been here for 25 years. Over the years, I've specialized in several cancer types, but more recently, patients who have advanced cancer of unknown primary site. Cancer of unknown primary site represents a patient who has spread of cancer. This is how cancers become very serious. They spread or metastasize. We know now that these primary sites, or where the cancers originated from, are just too small to find. Diagnostic ambiguity means that we're unsure of the diagnosis. It's ambiguous. We know they have cancer, we biopsy the metastasis, but we can't find the site of origin, or what we call the anatomical primary site.
My first-hand knowledge about how critical a proper diagnosis in cancer really stems from my experience with my own father, who was diagnosed with a cancer that was quite ambiguous. There was no certainty on the diagnosis. The pathologist's report said it could be, colon, it could be stomach, it could be pancreatic. We knew it was gastrointestinal oriented, but we really didn't know what it was. But it was very serious.
Most of the time, we know where that cancer has come from. For instance, the lung. Often this will require a biopsy or obtaining a small amount of tissue, so a pathologist can evaluate and say, well, this came out of the lung, this is consistent with a lung cancer. So those are known cancers. That's how most people, when they develop cancer, that's how they present, and we know what they are.
The typical process for the way I evaluate cases is either I'm found personally by patients or their family. Usually those patients and their family are struggling with either their general care, the diagnosis of cancer, deciding what treatments to get, and looking for other alternatives that may or may not have been offered by their oncologist.
In patients with unknown primary cancer, they have symptoms too, many different types, and we evaluate them, and we find the metastasis or spread of their cancer, but we cannot find where the cancer started or arose from, despite multiple testing.
My personal experience when someone is diagnosed with a cancer of unknown primary is absolute devastation. We are human beings, and we need to label things. We need to be able to say to our friends and our family, Bob has this kind of cancer. We need to reach out to supportive communities in person or online and express, this is what's happening to myself or my loved one.
Determining the type of cancer that a patient has can be important for a number of reasons. Certainly it's important if one is determining what type of treatment to give the patient. but it's also important in determining the type of cancer present in terms of estimating the prognosis, and in some instances is important for the family.
One of the most critical moments when a family member is diagnosed with cancer is that experience of sitting with the physician and having them explain the disease and discussing, the odds of treatment and having actual discussions about possible mortality.
Treatment for various types of cancers vary considerably. They're different. So knowing the cancer type is critical. That should be the goal of the physician, to determine the cancer type. That has been the goal of physicians in patients who've had CUP for years. The problem is they haven't been able to determine it because our technology was not sophisticated and accurate enough up until this time to determine that.
Coming up after the break, a scientific test changing the paradigm for pathologists and oncologists, and most importantly for patients and their families. Stay with us.
We're in an exciting time of diagnosis of cancer. We're in a phase called precision medicine, and part of that is providing a finer resolution of diagnosis.
With today's technology and the arrival of diagnostic testing, thousands of cancer patients and experts now have access to a new progressive test. A test so accurate, more than 25,000 patients and nearly 10,000 cancer experts use it to determine where a particular cancer originates. And maybe, just maybe, save a life. Here's more on the story.
My name is Catherine Schnabel, and I'm the Chief Scientific Officer of Biotheranostics. And I've had the privilege of serving cancer patients by my role for the last 6 years. We're in an exciting time of diagnosis of cancer. We're in a phase called precision medicine, and part of that is providing a finer resolution of diagnosis. And we're now in a stage where we're actually looking at the molecular and genomic features of the cancer to enable better decision making and not only diagnosis, but obviously treatment for patients.
The ability to diagnose the type of cancer that a patient with CUP has is extremely important. It's changed the whole field of how we manage these patients. Previously, we used to treat most patients with CUP with what we term shotgun therapy. We used one regimen of chemotherapy for all the patients. It could help some patients, but it was clearly inadequate. It wasn't treating the patients specifically for the type of cancer they had, it was treating them all the same. And now we have so many treatments. Some are targeted, precision treatments based on molecular abnormalities in the cancer cells, and it depends first on knowing the type of cancer a patient has before embarking on the specific treatment for their cancer.
When people are diagnosed with cancer, more often than not, it is done through an educated best guess. And patients are told a certain cancer, but maybe the details are not specific. That ambiguity can have a devastating effect on all patients.
Many times when we have a patient with CUP, we put all the information together, and even though we're not sure where the cancer actually came from or what type of cancer it is, we make a guess. We make that guess in good faith because we want to try to give the patient some therapy that hopefully will help them.
With my father being diagnosed with a cancer, but having absolutely no positive biopsy for pancreatic cancer, I was enormously uncomfortable with the uncertainty. I felt that we should gather more information. My father chose to do treatment, and he has every right to make that decision, but I felt that if he could find out exactly what it is, at least he could make a decision for purposeful treatment.
Now we don't need to make the guess as often as we used to because we have the diagnostic technology to determine precisely and accurately what type of cancer that patient has. No longer need to guess, and we can then treat the patient for the cancer they have.
CancerTYPE ID is a pioneering and unique diagnostic test that we developed several years ago at Biotheranostics. The test is performed on a patient's tumor tissue, and it looks specifically at the expression of 92 genes to render a molecular diagnosis, which can be used to provide more accuracy to cancer cases that are difficult to diagnose or clinically challenging.
Physicians order or should order the CancerTYPE ID when they are unclear about a single diagnosis in a patient who has metastatic cancer or advanced cancer. If they're uncertain of a single diagnosis, they should order the CancerTYPE ID to help determine the single diagnosis, which would then help determine the appropriate treatment for that individual patient.
The significance of CancerTYPE ID and this level of science is that it provides a higher resolution view of the patient's underlying tumor biology. By providing this increased resolution or molecular portrait of the tumor, it's improving patients' lives by allowing them to have an accurate diagnosis and to enable physicians to feel confident about the therapies that they're selecting for their patients. The other benefit of this test is that it requires very limited material to actually provide that molecular result. And in the era where there's less invasive biopsy methods that are being implemented, this becomes increasingly important.
There's considerable published information showing that this test is about 90% accurate in determining the cancer type, both in those with known cancers, which the known cancer serves as a gold standard to validate the CancerTYPE ID, and in those patients with unknown primary site. Our research program decided to use the CancerTYPE ID starting in 2008 because we felt that it was a superior test for a number of different reasons. The information giving us confidence in the molecular cancer classifier assay CancerTYPE ID comes from thousands of patients who've had the test, its accuracy in known cancer type, the extensive study done in patients with CUP, and the clinical application in prospective studies, in several retrospective studies, where you look back at patients who were treated based on the CancerTYPE ID diagnoses.
This tool is utilized by both pathologists and oncologists. For the pathologists, who are the diagnosticians of the cancer case, this is a molecular complement to their standard workup. For the oncologist, who's the point of integration of determining which therapy to apply to the patient, this is also an additional piece of data that they can use to fortify the clinical picture that they have and apply more accurately the treatment of choice.
In the past 4 decades, we've come from not knowing what type of cancer a patient with CUP had, virtually ever, to not having any therapies which helped the overwhelming majority of patients, to an era where we could diagnose some of the patients, treat some of them, but not very many, to a more modern era now where we can diagnose the type of cancer that the patient actually has with specialized pathology and molecular testing, and therefore treat the patients for what they actually have and give them the same prognosis as their cohorts or other patients with known cancers that have spread or metastasized.
Coming up, the power of a precise diagnosis, benefits of timely testing, and spreading the word so cancer patients everywhere get a fighting chance. For cancer patients, getting the tools needed to survive one more minute, hour, or day is priority number one. Accurate diagnosis is perhaps the most vital tool in prolonging time and nurturing hope for better cancer-free living. That's why getting the word out about tests like CancerTYPE ID is so crucial.
So the oncologist ultimately has the hierarchy to deal with the life and death issues. And oftentimes they make decisions based on what is in the patient's best interest in terms of comfort. The longer a diagnosis is going on, the more advanced the cancer, oftentimes they make a decision saying, I'm going to make it as comfortable for this patient as possible. This is not always acceptable to the family, but the physician, the oncologist, really has no means, they don't have the time to anticipate how the family will feel about this.
This information gives them some reassurance. Well, now we know what type of cancer it is. It takes some of the fear, not all of it, out of having this diagnosis. I think it helps a lot of people. Sometimes it helps a lot more because we've determined that the patient has a very treatable cancer type and the prognosis will be better. Other times we determine the patient has a less treatable cancer type and the prognosis will be worse, but at least the patient knows where they stand and their family knows where they stand. And it's very important.
That also impacts your family members because they're finding that patients with cancers of unknown primaries, their families actually have an increased incidence of cancer. So if you don't understand what your diagnosis is of cancer, it has widespread implications not only from the clinical perspective, but certainly from the personal perspective.
For my father, what the CancerTYPE ID did, it actually clarified 6-7 months of uncertainty. At the end of the day, no matter where my father went after this moment where he understood that he did not have pancreatic cancer, where the family understood, at the end of the day, we know now what my father went through. Making peace with what your loved one went through is often the most healing thing you can do. I don't know how you would even do that if you don't know what your loved one died of. How could you ever get that closure?
If you are confident about the type of cancer your family member has been diagnosed with, that informs family members about predisposition and about prognosis and can be managed very differently with that clearer picture of what a family member's cancer type was.
I have a 10-year-old daughter. I want her to know. I want her to know what her grandfather died of. I want her children to know. Finally understanding, without a doubt, where the origin of my father's cancer came from helps me. It's comforting because I want to know my family lineage. I have a 10-year-old daughter. I want her to know. I want her to know what her grandfather died of. I want her children to know.
The goal of oncologists or physicians in general is to help people. When patients present with cancer and we can't determine precisely where it came from or the type it is, it's the goal of their physician to use all available technology that's reasonable to determine what type of cancer an individual patient has.
I think molecular tools such as CancerTYPE ID are the gateway to individualizing care and precision medicine. And I think it's important for both physicians and patients to know that this type of technology is available to them.
The truth is, end of the day, people do get cancer. They do. It is a tragedy that happens in most families. And if you could avoid the ambiguity, uncertainty, it's like the worst word in the world when it comes to being sick. We don't know exactly. If you can avoid that, you can save lives, you can save families, you can bring people together, and you can make a really, really miserable experience maybe just a little more bearable.
We want to thank all of our dedicated doctors and especially Cheryl for sharing her personal story. And we also want to extend best wishes for the very best in health to each and every cancer patient hoping for a better day. For more information on CancerTYPE ID, go to CancerTYPEID.com. And of course, you can always log on to our website, AccessHealth.tv.